Well, good morning to everyone, and thank you for being here and watching online at home. I'm glad to be with all of you again today. It's been a couple of weeks since we had one of these updates, but I talked to Henry, Cam, and Jackie, and they said it was time to do this again, so we're glad to be with you this morning. A year ago, we were doing these, believe it or not, 7 days a week, and we are in a much better place now. We have good news to share with all of you today about our COVID numbers, our vaccination rates, and what we expect going forward. We always like to start with a number, so let's get to that. First, we are seeing a welcome drop in our daily count of new COVID cases. For the past 2 weeks, we've had fewer than 1,000 new cases per day in Virginia. Our positivity rate is now at 4.4%, and our 7-day average is now lower than it has been since last October, 7 months ago. That's a big deal after a hard year, and we should all celebrate that. Let's look at another number, one that's been hard to face over the past year. How many people are in the hospital with COVID? We have good news on that front as well. We're now seeing the lowest number of people hospitalized with a positive COVID test since last October. Today, it's 847 people across the state, so there's still virus out there. There are still people in the hospital. And even more painful a number is how many people have died. Every death is tragic, but this is a hopeful sign as well. We've seen a dramatic drop in COVID deaths in recent weeks. These are all very positive signs. We've been following the data and watching the numbers for more than a year. This has informed every single decision that we collectively have made. And today, the data give us a very clear message. The vaccines are working. Let me say that again. The vaccines are working. They're helping reduce the spread of this disease. Fewer people are getting sick. Fewer people are going into the hospital, and fewer people are dying. More people are now spending time together. More people are hugging the people that they love. More people are getting to do things that they enjoy once again. Vaccines make all of this possible. That's why so many Virginians are choosing to get a shot. Here's where we are overall. Almost 46% of Virginians have had at least one shot of a COVID vaccine, and 1 in 3 are fully vaccinated. As you can see, vaccination rates still vary by locality. But we're doing well overall. Let's break these numbers down. We know that almost 80% of Virginians age 65 and up have had at least one shot, and more than half are fully vaccinated. 3/4 of our school personnel have had at least a first dose. 2/3 are fully vaccinated, as are 66% of the inmates in our correctional facilities. I'm glad to say that the Department of Correction has only 7 active COVID cases right now. Right now, everyone age 16 and above is eligible for a shot. So when you look at the numbers this way, Virginia has even better news. Among everyone who is eligible to get a shot right now, almost 60% of people have received at least the first shot. That is just great news, and I want to commend Virginians on being part of the solution. These are all great numbers. I'm grateful to everyone who has gotten their vaccine already. So many health workers, doctors, nurses, and first responders have given their time over these many months at vaccination clinics, and we are especially grateful to you. Everything has changed over the past year, and the vaccination effort alone has changed just since January. It's continuing to change. So before we discuss the next step, let's all remember where we've been. First, as the year began, we focused on people who were most at risk of getting COVID. people who live in our nursing homes. Then, as supply increased, we opened eligibility to older people and those with underlying health conditions. By February, it became clear that we finally had a partner at the federal level. After a tough year, that's when I finally started sleeping through the night. A few weeks ago, every adult in Virginia became eligible, and recently the FDA allowed 16 and 17-year-olds to get the Pfizer vaccine. So far, we have vaccinated almost 63,000 young people between the ages of 16 and 17. So this is all very good news. We expect the federal government to approve the Pfizer vaccine for children aged 12 and over very soon, perhaps as early as next week. You don't have to be a pediatrician to know that that's good news. Parents are eager for their children to be able to get this shot. Preliminary results from a VCU survey tell us that a large majority of parents, 66%, plan to get their adolescents vaccinated. 63% will vaccinate their younger children when it's available. This is great news for getting back to normal, and we're ready for it. Our Virginia Department of Health has been planning for the best way to get adolescents vaccinated. We are working with school divisions and superintendents to encourage everyone to get a shot. Our teams are meeting with school divisions early next week, and I know our colleges and universities are meeting regularly too. Everyone is making plans for the future and how to reopen as safely as possible. I'm confident they will all make the right decisions in the best interest of their community. The bottom line is that we want everyone who can get vaccinated to get vaccinated. I got a shot. My family got a shot. Everyone who works in this building got a shot. I hope everyone in this room today got a shot. And I'm seeing pretty good eye contact from everyone, so that is encouraging. And getting your COVID vaccine has never been easier. Vaccines are now widely and easily available in Virginia. They're in grocery stores, in doctors' offices, in pharmacies, the places where you're used to getting your health care. And of course, they will continue to be available at your local health department and in hospitals across Virginia. Our community vaccination centers are CVCs, large sites with the ability to give thousands of shots per day. Just this week met our goal to give 300,000 shots. And next week, we will launch new mobile vaccine units. Together with local health departments, these will focus on underserved areas. You're starting to see other steps forward as well. All of our community vaccination clinics now welcoming walk-ins. So are many of the pharmacies in Virginia. You can just walk in and get your shot. You don't need to register, and you don't need an appointment. You just go. And this is, again, good news. It's what we all envisioned when we heard a vaccine was finally ready, a vaccine that is easy for everyone to get. To find out where, again, go to vaccinate.virginia.gov and type in your address. The federal government also just launched a text feature. You can text your zip code to GetVax. That's GetVax. And it will tell you 3 vaccination sites near you. Or you can call your doctor. They can point you in the right direction. All of these are positive developments. They are huge steps forward. We still have a lot of work ahead to meet President Biden's new goal of 70% of American adults getting at least a first shot by the 4th of July. But make no mistake, I feel confident that Virginia can do our part to reach that goal, and we will. Now, like most other states, we're seeing a change in demand for vaccine. That yellow line is our average daily shots. We know there are a variety of reasons why someone who is eligible hasn't been vaccinated yet. Some people may not know that they're eligible. I want to be clear. The only eligibility requirement now is that you're 16 or older, and soon that will probably be 12 or older. And it doesn't matter if you are a frontline worker or have a medical condition, everyone 16 and up is eligible. Others may not realize that they don't have long wait lists for appointments anymore. Now getting vaccinated is easy and free. You don't have to pre-register. We have an address search tool on vaccinate.virginia.gov, and you can call 877-VAX-IN-VA as well for help finding a place to get your shot. And some people haven't made it a priority yet, or they're uncertain about a new vaccine for a new disease. If you have questions about vaccines, we'll be glad to answer them. And I'd also encourage you to talk to your provider. They can tell you that while these vaccines may be new, they are built on years' worth of testing, research, and experience. We're going to keep reaching out to all of these folks. The bottom line is when you get vaccinated, you protect yourself, you protect your family, and everyone around you. Over the past 14 months, we've learned a lot about COVID, and one thing is that it is an unpredictable disease. It can put anyone in the hospital, including young people. It can cause long-lasting, debilitating side effects. As you all know, I had COVID myself last October, and 7 months later, I still can't smell or taste anything. Many long-lasting side effects are much worse. If you haven't gotten the vaccine, remember this. COVID can make you truly sick for months. The variants that are now circulating raise the risk of getting sick. So please protect yourself from going through that and protect the people around you too. I've had COVID and I've had the vaccine. And between the two, it's an easy choice. I'll take the vaccine any day. Getting vaccinated also comes with another important benefit. It is the only way that we as a community, as a Commonwealth, get back to normal. Vaccinated people can safely do more things. They can socialize in small groups without masks or social distancing, for example. They don't have to get COVID tests before they travel. Last week, we updated our mask guidance to align with new CDC guidance that vaccinated people don't need to wear a mask outside unless they're in a crowd. Starting May the 15th, next weekend, we're planning to relax a few more measures. This means 100 people at a social gathering indoors and 250 people outdoors. 50% capacity for indoor entertainment venues, up to 1,000 people, and 50% capacity outdoors with no cap. Restaurants will be able to return to selling alcohol after midnight, and dining rooms can stay open later. This is possible because everyone has been working so hard and so many people have been getting shots. We need to keep doing that. If our COVID numbers keep trending down and our vaccination numbers keep going up, we plan to lift our mitigation measures, capacity restrictions, and social distancing requirements on June the 15th. We'll continue to evaluate our mask guidance. But this is good news, and it's thanks to the millions of Virginians who have done the right thing for so long, and I say thank you. We still have work to do. We are not at the finish line yet, and we still need to take the precautions that we all know work. But we're approaching a time when we can think differently about how we interact, especially people who are vaccinated. So please, I'm going to say it one more time, get your shot. If you're on the fence, talk to your doctor. The vaccine is free, it's easy, and it could save your life. It's the best way for us all to get back to doing the things that we love to do. Now, before I turn to your questions, I want to note a couple of celebrations this week. First, this is Teacher Appreciation Week. I would not be standing here today if it was not for the excellent teachers I had when I came through school. And this year has taught us all a much greater appreciation for everything our teachers do to help our children. It's been a difficult year for teachers, students, and everyone else. This is also Resilience Week in Virginia. Resilience is about how we respond to adversity or tragedy or trauma. If you don't know what resilience looks like, know this: you have lived it over the past year. This year has required a lot of resilience out of everyone, especially our children. Resilience, it's like a muscle. It grows stronger the more you use it. We've all built up that muscle over the past year. Today is also National Nurses Day. As the son of a nurse and having worked with many nurses during my career, I have seen firsthand the sacrifices and commitment nurses make. We have leaned heavily on our nurses for the past 14 months. And on behalf of the Commonwealth, I want to say a heartfelt thank you. Words alone cannot express how much we owe to our nurses and to all of our healthcare workers. So we thank you for all that you do. Happy Nurses Day. I'll be glad to take questions.
Do you believe the administration will mandate the vaccine for children in school? I guess, one, your thoughts on that, and also, two, if that was even a thing, what would that process look like?
Yeah, it's a great question, Henry. And I don't anticipate at the state level mandating the COVID vaccine. As you know, other vaccines are mandated, but it's a process that would need to take place. It would have input from folks like the American Pediatric, the Academy of Pediatrics, input from the CDC, and then finally the legislature would actually have to act on that. So one, I don't see that happening in the near future, and the process would certainly take time. But I would just reiterate, rather than mandate things, you've heard me talk about this before, I'm a carrot person rather than a stick person. We've been fighting this pandemic for 14 months now. The way to get this in the rearview mirror is to get as many people, whether they're adults and children. We know that we have 3 safe and effective vaccines, the Pfizer, the Moderna, and the J&J. And so we're going to continue to just encourage everybody and really do everything that we can to take our vaccines to the people. I tell our folks every day, be flexible, be creative, and that's what they've done. And I think it's why we see, still the rate of vaccinations at very good today, or yesterday rather, 88,000 shots were given. That's just really, I think, very commendable for Virginians and also for the folks that are working at these clinics. So, this is I think it's certainly a message to our families and our children. We anticipate the vaccine being approved by the FDA for 12 and older, and then perhaps in September of this year for even infants 6 months and older. And so now is the time to plan. And certainly as a pediatrician, I've had conversations with patients on a lot of different levels, but start thinking about it. Have those conversations at home with your children, your families, and have those conversations with your friends and especially your provider. But I say get ready. Because it's going to be soon, and when it's available, we're going to be ready. So I want Virginia to be ready to get that vaccine.
Christina Thompson, ABC 13.
We know that a lot of other states have already dropped their mask mandates, and I'm wondering what exactly.
It sounded like the question was mask mandates, and it's a good question, and we're following the CDC guidelines, and I'm not going to reiterate those right now, but there are guidelines from the CDC for outdoors, for whether someone's been vaccinated or not, and whether you're in a large crowd outdoors, and then indoors. And so those are well spelled out, I think, in the CDC recommendations, and we will follow those, and there will continue to be discussions with masks. As I said earlier, if our numbers continue to trend favorably, and we can have the opportunity to get adults vaccinated by the end of May, we look forward to lifting these measures on June the 15th.
And just sort of further to that, so for lifting on June 15th, do you have a decision date made, and then do you have set thresholds of we want cases or percent positivity to be 3.5%, and we want eligible population vaccination rates to be at X?
Yeah, there's no real specific numbers. As I've said before, Cam, we look at the numbers every day, and they certainly are trending favorably. And I think it's really up to Virginians the way we move forward now. We have the vaccination supply in Virginia, and we're going to get approval for our children. So by the end of May, we anticipate individuals that choose to do so to at least have had that first vaccine. I want to take this opportunity, if I can. There have been some questions about planning. There's questions about sports, a lot of these things. And my Chief of Staff, Clark Mercer, deals with a lot of these. So I'm going to let him kind of go into a little bit more detail on some of that. So Clark, welcome.
Thank you, Governor Northam. And every time we have a press conference like this and we get a lot of follow-up questions, I want to start with thank yous. Over the last year, our Department of Health and our Secretary of Commerce and Deputy Secretary Cass Rasnick have led the effort on these mitigation measures, and they've done a tremendous job. When it comes to youth sports and recreational high school sports, a big thank you to the Virginia High School League and Billy Hahn, who's their executive director, his staff, and their board. VHSL is an independent entity that we have worked with, and they deal with high schools with a couple hundred kids to over 4,000. So we're talking small ball fields to large stadiums. And just a couple notes, and they've done tremendous work keeping our student athletes safe over the last year. And thank you, obviously, to our student athletes and their parents for being such good stewards of the public's health over the past year. The governor mentioned vaccinations and what gets to open up if you get vaccinated. We have seen at the professional sports level and college level what happens if there's breakouts on teams and students, athletes need to quarantine. If you're fully vaccinated, you don't have to quarantine. You don't miss a week of sports. You don't miss the big game on the weekend. So if you're a student athlete getting ready to play fall sports, winter sports, spring sports, get fully vaccinated. That's not only going to be a benefit to you, but certainly to your team. And we've got a number of businesses that will be affected on June 15th when the governor says we will lift the capacity. So the number of individuals will go to 100% capacity. The question we always get, well, what about the mitigation measures? 6-foot distancing at a concert venue or between swim lanes or at a theater keeps us from being at 100% occupancy. So those measures, barring some significant downward trend in our health metrics, will be lifted. So if you're planning your swim league, or if you're planning for opening your theater, or if you're planning your yoga studio, plan on June 15th to be able to go to full capacity. Obviously, there's always the caveat that if health metrics take a dive, we're going to need to address that. And lastly, a question was asked about masks and mask mandates. The governor's executive authority and emergency declaration expires on June 30th. And like the governor said, he will revisit in a future press conference how we talk about masks. Even voluntarily wearing a mask in Virginia, you have to have a state of emergency in effect to do so. There's law in a book that does not allow you even voluntarily to wear a mask in public. So there's some issues we have to work through between now and the end of June. But like the governor said, the expectation on June 15th is to lift not only the occupancy limits, but also the mitigation measures that I mentioned. So thank you.
Not for the governor or whoever can take it, but just you mentioned additional mobile clinics starting next week. Can you give more details? How many, where in the state they're going? Is this going to be state or a contractor?
Yes, great question, Cam. I'm going to let Dr. Abula address that. Danny?
Thanks, Governor, and thanks, Cam. The question is, what's the plan with mobile vaccination clinics We have been doing a fair amount of mobile vaccination even through the first 4 months of this campaign. Many health districts purchased vans with the first tranche of federal funding that came in and have been using them every week. Many partners like our health systems and even academic institutions in some cases have mobile vans and have been using those to get out to more marginalized communities as an adjunct to the large-scale mass vaccination that we've been doing. Additionally, we are contracting through FEMA dollars. VDEM is working out these contracts and with 7 different vendors who, and those are being made available to districts that feel like they need that additional mobile capacity. Largely, this will be helpful in rural communities where these vans will be set up to go out on 14-day excursions, somewhere between 50 and 250 doses a day. We're kind of working out the details on will that primarily be Johnson & Johnson, which does make sense given the kind of rural nature of a lot of these mobile clinics and not being able to guarantee we'll be able to come back. But in some cases, we may be offering other doses, kind of working out some of those details right now. So what we plan to do for this upcoming week is really do a full court press on the community engagement in those communities, making sure that there are teams of outreach workers and community health workers who are building awareness, letting the community know mobile clinics will be coming the following week, and really maximizing the opportunity for people to get the word out there and prepare for that. And then the week of the 17th is what we're now shooting for these mobile clinics to be underway. Again, many mobile clinics are already happening right now. In fact, I was at the Richmond office yesterday, and as I was walking out, 2 of our spectacular nurses were just coming in off the mobile van. They had spent the morning at a community a rec center and the afternoon at a processing plant and had done about 65 doses in a day. And I say that to illustrate that this is a very different phase of the vaccination effort, right? We're not going to be able to do 3,000, 4,000, 5,000 doses a day. These mobile efforts are absolutely going to help us get to folks who wouldn't come to something otherwise, but it is going to be slower and harder work. But we're prepared to do it. So really excited for all of our nurses, and happy Nurses Day to all of you who will be out doing that work.
With VPN.
Yeah, thank you much. Most localities outside of really just select few are still seeing vaccination rates below 50%. Many are still sort of a good ways off from the 75% goal. But I'm wondering, besides mobile clinics, what is the state planning to do to try to address sort of issues around vaccine hesitancy and access to try to deal with the waning demand issue?
It's a great question. The question is about vaccine hesitancy, and as we've said before, our goal really is we'd love to get everybody that can vaccinated, but we certainly want to get to 70 to 75% of the population. That's where herd immunity occurs, and that's frankly where we can put this COVID-19 definitely and permanently in the rearview mirror. We won't have to worry about the variants that are out there. You all have heard all that, and so. As far as the hesitancy, I mean, there are a lot of different angles that we're coming from to address that. Certainly there are some individuals that have trouble registering, so now we've taken that off the table. People can just walk in. There are some people that have transportation issues. At the major sites, we have really worked hard, even with child care, for those individuals that have difficulty with that. And then the trust issue, we understand that. We're working with community leaders. We're working with prominent figures. A lot of athletes have stepped up, for example. And we're also working with our faith leaders. We're also being creative. We've talked to businesses. We certainly don't have a statewide program, but there are some businesses, I think, that are willing, for example, to give a drink voucher or you name it, and so we're open to that as well. But any way that we can get more shots in arms, we're trying to be as creative as we can, and certainly if the public or the media or anybody else out there has suggestions on how we can deal with that, we're open to that. We don't have a monopoly on ideas, so thank you. Andre.
Thank you.
Governor, my first question is not COVID related. For those who question your selection and endorsement of Terry McCullough.
Yes.
Though some people see you as a diversity guy, a guy who's championed those causes, but yet you did not endorse Justin Fairfax or Senator McClellan or Delegate Jennifer Floyd. Could you talk about that selection process?
Sure. I appreciate that, Andre. And, I would start by saying we have great candidates, and a number of them running for governor, lieutenant governor, and attorney general. Regarding the governor, I've worked with Terry, obviously, for 4 years. I was his lieutenant governor. We're going to be coming out of COVID. It will be very important to continue a lot of the things that we've been working on, and we want someone that can really hit the ground running on day one, and so that's why I chose to endorse him. And there are reasons I don't think it's necessary to get into them now, but why I've endorsed Hala Ayala for lieutenant governor and Jay Jones for attorney general.
For those who, again, you kind of alluded and said a little bit about it, but for those who say they're still on the fence or won't even take the vaccine,
Yes.
Is that just kind of how it is? Are these folks impossible to reach?
I don't think anybody's impossible, Andre, and we're just, I think, continue to encourage folks and meet them where they are, listen to their concerns, try to, discuss those concerns and work through it. The way I look at this personally, I served in the Army, as you know. I've seen what happens when our country is at war, and the way we win wars is for everybody to join together, to put our politics aside and a lot of other things aside and really do what's in the best interest of the country. And really, you could use this as an analogy. We've been fighting a biological war for the last 14 months. And this is not so much about ourselves, but it's about Virginia, and it's about this country. And the way to win that war is to get vaccinated. It is just that simple. And so I would ask everybody to, to put themselves, obviously we take care of ourselves and our families, but think of the bigger picture and think about this country, think about, in our case, the Commonwealth of Virginia, and do what's in the best interest of Virginia. And I think that, if we can all do that, we'll really put this behind us and be able to move on to a near normal lives and get our businesses back up and running, get our children safely back in school, and I think everybody hopefully can appreciate that.
Nick Mina with WJLA.
Hi, thanks. Hi, Governor. We recently did a story on how Fauquier County schools will no longer require kids to wear masks at outdoor recess and PE classes, but there are other Northern Virginia school districts that are requiring kids to wear masks outside. So with the weather warming up, what's your stance on some students still being required to wear masks outside while at school? And would you encourage school districts to ease those rules?
Well, thank you for the question. And I think we have to remember, the first thing that we have to remember is children have not been vaccinated, especially those that are less than 16. And so anytime that children are gathered, whether it be indoors or outdoors, in where there's numbers and they're in close proximity to each other, they're at risk. And there have been complications that children have had when they've contracted COVID-19. So while they have better outcomes, they can still have sequelae from COVID-19, and they can also take it home to their families, friends, etc. So we'll continue to follow the CDC guidelines, and that applies to children as well.
Yeah, two questions. So in regards to the CDC guidelines on masking, are you saying that you aren't going to lift the mask mandate unless the CDC gives you the okay from a federal level? I'll wait for my second question.
Well, I appreciate that, Jackie. We've had a number of these press conferences. So, I don't say that it's written in stone, but, we all like to follow science, and the CDC certainly uses their science. And so as we move forward, I anticipate following those guidelines as closely as we can. I don't anticipate us differing a lot with them.
Okay. And then your chief of staff just mentioned the June 30th date for the
June 15th. Oh, June
30th for the expiration of the state of
Yes.
emergency. Are you saying that you are considering not extending the state of emergency after that June 15th expiration date?
Absolutely. because I hope to have COVID-19 in the rearview mirror. But the mask mandate, again, not all children, especially, will have been vaccinated by June the 30th. So we've got to work through the details of how we deal with masks, especially if the CDC still is recommending that.
I don't know if you can just clarify based on that, if the state of emergency does end on June 30th, kind of what obviously a lot of these orders hinge on that. So can you explain what the impact of that would be?
Do Clark or Rita, you want to try to? Yeah. Rita Davis, our lead counsel. Welcome, Rita.
Good morning. As I understand, the question is, what is the potential impact of the expiration of the current the declaration of state of emergency? So by code, all declarations of states of emergency end on June 30th. So the governor has the prerogative to reissue a declaration of a state of emergency. As the chief of staff has alliterated that one of the things the code requires for people to wear masks legally in public is a state of emergency declaration. So the governor will consider whether or not, if under the CDC guidance and I guess the advice from the Virginia Department of Health, even folks who want to voluntarily wear a mask will need to do so legally, which may mean that the declaration may have to be extended or reissued so it will apply after June 30th. Does that help your question?
Yes. So you're saying that you might have to extend it just for the purpose of continuing the mask mandate, because otherwise in Virginia it's illegal to wear a mask in public.
That is correct. Thank you. Thank you.
All right, Jimmy LaRue with the Suffolk News Herald.
Hi, Governor. Thank you for taking the call. So the percent positivity and the number of positive COVID-19 cases, the hospitalizations and deaths are definitely down, as you said. How will you ensure that there's enough testing being done to feel that you have a good sense of community spread and have the most accurate data to determine that? And are we doing enough and testing enough at this point?
You know, we haven't backed off of our testing capabilities, and so if there are individuals out there that, especially if they're feeling symptoms or whatever, we encourage them to be tested, and we'll continue to do that. So we have that capacity in place, and you know, what we'd like to see is these numbers continuing to trend down, less people getting COVID-19, and so we'll just have to see. But in the meantime, we do have the capacity to do the testing that we need.
So, Governor, with the state of emergency potentially expiring, my understanding is that that would also end the state's pandemic eviction protections. So I guess I'm just curious, is that something that you're concerned about? On that front, do you feel like that's run its course, it's no longer necessary, or where are you on that, I guess?
No, I would never say it's not necessary. I mean, we want people to have a roof over their head, especially with COVID-19. So, you know, I said that without getting kind of into a lot of the details, we certainly don't want our state of emergency to go any longer than it needs to be. We want to put COVID-19 behind us, but there are some details that we need to work through, one being eviction that you just brought up, and it's a great question, the mask issue, and so we'll continue to work on that. Thank you all so much. And Henry, just wanted to let you know that I'm going on a trade mission. I will be out of the office for a few days. We'll be overseas to really continue to try to help businesses grow in Virginia and attract new businesses. But I will be back in a week or so. So keep planning, keep thinking, and we'll all put our heads together and decide when we're going to have our next press conference. But in the meantime, thanks for being here. And as I always like to say, thanks you to the press. I mean, you all do a wonderful job, and this is so important to get accurate news and information, and it changes every day. So we really appreciate all that you all do, and look forward to seeing you soon. And to everybody in Virginia, thanks for being with us today. Stay safe and healthy, and we'll see you soon. Thanks.